Welcome back. In today's episode, we're going to be talking about routine pregnancy care and what to expect.
Now, it's important for us to remind you that we are family physicians who provide maternity care. You may also choose to have your pregnancy care by a midwife or an obstetrician. No matter who you choose in our province, we have the same standard of care when it comes to routine pregnancy care, so this should apply to you. And generally speaking, across Canada, providers will follow the same care model as well.
Let's dive into it.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
So, after your really long first prenatal visit, where we gather a ton of information about you and your medical history, family history, etc., we'll often have you back about 2 to 3 weeks later following that visit for a complete physical exam.
A physical exam in early pregnancy is important as it allows us to get a baseline picture of your general health, including your blood pressure, heart rate, etc. We can also often hear the fetal heartbeat at this visit if it takes place after 10 to 12 weeks of pregnancy. Additionally, if you're not up to date on your cervical cancer screening, this is an important and safe time to get your cervical screening done. We also do a routine breast exam, and this can be helpful when it comes to the conversation around breastfeeding, as we may note differences on the exam that could impact your breastfeeding journey, such as flat or inverted nipples, tubular breasts, etc.
So, after the physical exam, for the remainder of your first and second trimester, you'll routinely see your care provider at a minimum of every 4 weeks. This is for routine care and includes a check-in about your physical and mental health, a review of any worrisome symptoms you may be having, as well as a listen to your baby, a fetal heart rate check, and checking your blood pressure. Some providers will check your weight at every appointment, others will not. This may depend on a few things, including your pre-pregnancy weight and your provider's preference.
Now, it's important to note that we say minimum of every 4 weeks. For lots of pregnant people, they may require additional visits for a number of reasons, and that's totally okay. If you're having nausea and vomiting that's not well managed, if you experience pelvic pain or bleeding, or if you have an underlying medical condition that requires closer follow-up, we may see you more often. Or you may also be followed along by a specialist, an obstetrician or a perinatologist, which is an obstetrician who specializes particularly in high-risk pregnancies, otherwise referred to as a maternal fetal medicine specialist.
In addition to your routine visits every 4 weeks or so, it's important to note that you should have access to your care provider or a colleague of theirs who's covering for them on a 24/7 basis. Your provider may work in a large call group where there is a different provider on call every 12 to 24 hours, or they may work in a smaller group and cover on-call services for days or weeks at a time. Regardless of the model of care of your care provider, it's important for you to know how to access your care provider on call 24/7. And they should be able to provide advice over the phone for any emergent concerns or arrange for close follow-up either in the clinic or a hospital. This care extends from early pregnancy through labor and into the postpartum period. Now, please keep in mind, this access is really for emergency issues only, so please try to use this service judiciously. Remember, they're the one who's going to be delivering the babies, and you really don't want a sleep-deprived care provider delivering your baby. So if you feel it can't wait until morning, by all means call. But if it can wait until the daylight hours, then that's probably a more appropriate time to call.
Yeah, I agree. So if you wake up and you're bleeding, probably should call. If you wake up and you've been constipated, you can probably wait until the morning, right? It's those types of things that just use your common sense, and emergency things, absolutely call. Now, at the 18 to 20 week mark, in addition to regular visits, you'll be offered your routine anatomy scan. This is an important ultrasound as it takes a detailed look at your pregnancy. It assesses your growing baby from head to toe, including its brain, facial bones, heart, kidney, stomach, bowel, bladder, etc. It measures the baby's size and ensures your baby's generally on track for where we expect most babies to be around 20 weeks. The ultrasound also looks at a few other things, such as your uterus and your cervix, your placenta and its location, as well as other organs around your uterus. We go into much more detail about this ultrasound in our Pregnancy to Parenthood podcast series, which is our week by week podcast guide to everything you need to know about pregnancy. Check it out on our website, and we'll link it in the show notes below.
After your ultrasound, there's one more set of routine blood work that's generally ordered in the late stages of the second trimester, and this is your gestational diabetes screen. At the same time, we also take the opportunity to recheck your hemoglobin or your red blood cell levels and your iron stores, as often iron drops at this stage of pregnancy as your growing baby starts to store more and more iron to use in themselves to make their own blood. And so, oftentimes at this stage of pregnancy, people do get a little bit anemic or have low iron and need to start a supplement. If you want to learn more about anemia or low iron in pregnancy and or gestational diabetes, don't worry, we've got some podcasts that are focused specifically on those. We'll link them in the show notes below. So this blood work is usually typically drawn between 25 and 28 weeks of gestation.
And one more thing. If you are Rh negative, meaning your blood type is A negative, B negative, AB negative, or O negative, then it will be recommended that you get an additional blood type and screen and be offered ROGAM or WinRho, same thing, just different names, at 28 weeks. Now, blood type is a very confusing conversation at the best of times, so we're definitely not going to get into it any more than that today. But if you want to learn more, don't worry, we've got a podcast on that too, and we'll post that in the show notes below.
So we've covered your routine visits up to about the 28-week mark, which are generally every 4 weeks, and the final 2 routine investigations that include the anatomy ultrasound and the second trimester blood work. Now, if you're healthy and you've got an uncomplicated pregnancy, that might be it for routine investigations, except for the Group B strep swab. We'll touch a little bit on that later and when you might get additional blood testing or ultrasounds a little bit later in the podcast.
So after 28 weeks, your visits increase in frequency to every 2 weeks. This is because the further into pregnancy you get, the closer we like to keep an eye on your well-being, your baby's growth, your blood pressure, etc. At these visits, we'll continue to check in about your physical and mental health, do a blood pressure check, and have a listen to baby. We'll also start to check your SFH, your symphysis fundal height. This is a measurement that is done from your pubic symphysis. This is just below your bikini line, where the top of your pubic bone sits, where your pubic bones attach in the front, and where you may be getting some discomfort later in pregnancy. And we measure from here to the top of the uterus, which is what we call the fundus.
So you may be wondering, why do we do this measurement? It's really a widespread and simple physical exam technique that we can use to assess the approximate size of your baby. So generally speaking, we expect it to measure about 1 centimeter plus or minus your gestational age. So if you're about 20 weeks in your pregnancy, you should measure 19 to 21. Or if you're 28 weeks along, you should measure 27 to 29 centimeters. If there's a more significant difference, or if you're consistently measuring much smaller or much larger, that's when we would be prompted to get a more detailed assessment of baby and the amniotic fluid, and this is generally done by an ultrasound.
So these 2-week visits continue until the 36-week mark. At this point, we want to see you every week until baby arrives, whether that's at 37 weeks, 38 weeks, 39 weeks. You get the picture, up until 42 weeks and beyond. So if you're seeing a busy provider, it is definitely a good idea to book these weekly visits well in advance.
And certainly for those of us in Victoria, we see you weekly after your baby is born anyway. So even if you've booked them and you
Totally.
deliver at 39 weeks, then you still have a couple of appointments booked in advance. So that's always helpful. So the one thing that we often do, or we always do, or we recommend between the 35th and 36th week mark is the Group B strep swab. So this is a swab that's done along the perineum, so just inside the vagina and along the rectum, that's looking for a bacteria called Group B streptococcus. About 30% of the population at any one time will be a carrier, and there's nothing worrisome for you, the pregnant person, about it. But we do know that babies born to pregnant people that are Group B strep positive are higher risk of getting infections in their lungs, brains, blood. And so we recommend screening. And if you're Group B strep positive, we recommend antibiotics in labor or when you've broken your waters until babies are born to help prevent this infection. Now, we've got a great podcast on this as well, so we'll make sure that we link that in the show notes below. The other thing you might be wondering, that why haven't we mentioned it yet, are cervical checks in any of these visits. That's because generally speaking, they're not indicated at this point in pregnancy unless there's a concern that you're going into preterm labor. Now, there's one caveat to this that I would like to mention, and that is I will often do a cervical check or offer a cervical check around the 35 to 36 week mark just to be very sure that baby's head is down. I have been tricked by a couple of
Yeah.
sneaky little babies that I could have sworn were head down and were breached. And so I tend to check with the pregnant person and make sure that they're okay if I do a quick internal exam just to make sure that it is baby's head that is the presenting part.
Yes, and you can do that the same time as the Group B strep swab. That's what I was taught by my lovely preceptor many years ago. So, in terms of cervical checks specifically, as you get closer to your due date, we don't typically start offering them until at least 38 weeks, as believe it or not, even a simple cervical check can sometimes stir up some contractions. And we really want our messaging to be clear here, and that is you don't have to have a cervical exam if you don't want to. Now, that being said, many people are curious to know if their body started to prepare for labor. And assessing your cervix can sometimes, but not always, be an indication of if the process has started. So, if your cervix is moving forward, if it's softening and beginning to open up, that's a good sign that your body's starting to make the changes and get ready for birth. But if your cervix is still sitting far back, it's firm and closed, that doesn't necessarily mean that you're not going to go into labor in the next little bit. It just helps us get a bit more information about where things are at, and we can offer sweeps starting at 38 weeks if that's something you're interested in too. It's really important to know that it's not possible for us to check your cervix and know when you'll go into labor. We can just tell you what's happening that day and go from there.
Can you imagine how rich we would be if we could tell people when they were going to go into labor?
Oh my
And then
gosh. Right?
we had one of those seeing eye glasses. No, what's the
Crystal
seeing
ball.
eyeballs? Crystal ball. I
Seeing
know.
eyeball.
Wouldn't
A
that be
crystal
lovely?
ball. You're so funny.
See,
But you know what? We still don't know exactly what triggers labor, which is crazy,
is so
right?
true. Hey.
It's crazy. It's
Okay.
crazy. Anyways.
So we've covered a lot of ground here. We've covered the routine pregnancy care for an uncomplicated pregnancy. We also said we'd cover when you might get more visits or investigations. Now, this can be often hard to predict as it's not uncommon for individuals to have growth concerns based on their SFH or symphysis height measurements that might prompt additional ultrasounds. Additionally, if there was a difference noted on your 20-week ultrasound, low-lying or placenta previa, marginal cord exsertion, etc., then oftentimes we'll do a follow-up ultrasound to reassess the placenta, cord, and amniotic fluid. Again, we go into this in a lot more detail in our Pregnancy to Parenthood podcast on that topic.
Now, two other common pregnancy complications that often warrant increased visits and investigations include gestational diabetes and gestational hypertension, or high blood pressure slash preeclampsia. If you're diagnosed with these in pregnancy, you'll likely have some additional visits with your provider or a specialist, as well as additional monitoring, including ultrasounds and blood work. Now, we don't have the time to go into all the other complications that may arise during pregnancy today, but those are just the most common ones that warrant further investigations and probably more frequent prenatal visits.
Yeah, so we've talked about a lot of different things that are likely really new information for you today. So, blood type, group B strep, gestational diabetes, high blood pressure, low iron or anemia. It can really sound quite overwhelming, but we've got a great offer that will make it easier for you to learn about what to expect in pregnancy at more trimester specific points.
So, we have put together a weekly podcast series called the Pregnancy to Parenthood series, and you can listen to this as you progress through your pregnancy. It will discuss everything you need to know as you need to know it. Some of these episodes are from our library of podcast episodes like this one, but many are episodes you won't hear anywhere else. So head on over to our website and check it out. We promise you won't regret it.
Thanks so much for listening today and have a great pregnancy. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.